Hi everyone, I am Thandi and today I'll be talking about the Derlome regime, which is an exercise we perform during our exercise therapy treatments. Firstly, what is the Derlome regime? The Derlome regime is a method also known as the Derlome method. It is a progressive resistance exercise technique used to increase muscle strength and endurance. It involves performing 3 sets of exercise with gradual increasing of weight. The first set uses a lighter weight, 50 to 10%, and then we increase to the second using a moderate weight of 70% of 10 range of motion. And the third set uses a heavier, which is 100% of range of motion. This gradual increase in resistance is designed to progressively overload the muscles, leading to strength gains. Firstly, I want to insist on the progressive overload. The core principle of the Derlome method is to gradually increase the resistance weight lifted during each set. So this technique uses the 10 repetition maximum. It is used as a reference point to determine the weight of each set. The 3 sets. The Derlome regime typically involves performing 3 sets of each exercise. Gradual increase in weight. The weight is increased forms to set by set, starting with a lighter weight to a heavier weight. So the Derlome regime works hand in hand with the resistance exercises. So I'll be listing the principles of resistance exercises. Firstly, if a muscle performed is to improve, a load that exceeds a metabolic capacity of the muscle must be applied. That is, a muscle must be challenged to perform at a level greater than to which it is accustomed. That is the principle of the overload. Further, overload can be applied by increasing the intensity or volume. In strength training, the intensity is increased, whereas endurance training, the volume, frequency, repetition, and the time is increased. The SAID is another principle, and each word stands for specific adaptation to imposed demand principle. Adaptation produced by the training are highly specific to the nature of the stimulus or overload applied. SAID applies to all the systems of the body. The adaptations are specific to strength, power, endurance, functional activity, joint angle, sequence of muscle activations, energy systems, and virtuality, all other variables. Now the benefits of the Derlome regime is that it increases muscle strength. The progressive overload stimulates muscle growth and increases the muscle tone. Secondly, it improves muscle endurance. Performing multiple sets gradually increasing resistance can also improve muscle ability and even during sports. Thirdly, it enhances functional abilities, meaning you are enabled to do certain abilities that you cannot do without increasing your muscles. Fourth, potential for reduced injury risk. Stronger muscles and improved joint stability can help reduce the risk of injuries. Thank you.